this thing we call psychedelic exceptionalism, where one thinks that their drug is more superior, better, whatever adjective you like to use. I'm going to show how that sort of thinking is not only dangerous, but it has become deadly in the United States. Before 1986, really, but late 1985, cocaine, powder cocaine, was seen as a glamorous sort of pursuit. But by the summer of '86, cocaine, specifically crack, had been disparaged and vilified. Crack was blamed for all that ailed our society. And so that meant that the people who used crack were vilified, as well as those who sold crack. Now, one of the things that we did that's important, well, Congress did the only thing that they could do. They passed a law. And this law is now infamous. This is the crack powder law. This is the law that punished crack cocaine violations 100 times more harshly than powder cocaine violations. You may know by now that crack and powder are the same drug. Crack is just the removal of the hydrochloride portion. That's it. But in terms of the behavioral or the biological effects, the hydrochloride portion doesn't have any effects. And so the effects are in the base. And the only sort of difference that we see is based on route of administration. One of the most important things that this law did, it really solidified and codified our drug war. The war on drugs is really there to make sure we have this funding stream. That's one of the main reasons. Another reason is that it allows us to go after people that we don't like, but we can't explicitly say we don't like these folks. So the drug war is ideal because you say, you're not going after those people, you're going after drugs. If we're just thinking about the crack powder law, more than 80% of the people who have been arrested and convicted for those laws are Black. Now, in the 80s, we believed that Black people were the primary users of the drugs. Not so. That's just white folks always made up the majority of crack smokers. I mean, just the sheer numbers in the country will tell us that. But Black folks are disproportionately arrested for these laws. Now, another drug, let's think about these two drugs. On the slide here, I have phenylcyclidine, PCP, on the left, and on the right, ketamine. These are two anesthetic drugs, or that's just how they were first developed as anesthetics. PCP was considered an effective anesthetic. One of the reasons that its clinical utility kind of waned was because its effects were a bit too long. As a result, ketamine was developed by altering the PCP structure. And so PCP and ketamine produce many of the same effects. They are very similar drugs, excepting that ketamine's effects don't last as long as PCP's effects. Now, some of you all know that PCP, the sort of narrative, the public narrative that's driven largely by police, is that when people take PCP, they become violent, aggressive, they even develop superhuman strength. They need to be shot 28 or more times in order to subdue them. One of the crowning ironies is that today there are many places where EMTs, they give ketamine to calm people down, right? The aggression, the violence that we said was provoked by PCP. We give PCP's sister to deal with, to subjugate the folks who are suspected, who are deemed uncontrollable. We've studied ketamine in the lab for a number of things, largely to treat substance use disorder. With some success, which is a lovely thing. Ketamine is also now approved as an antidepressant medication. It's a lovely thing. And the bottom line is that people who have looked for this sort of violence that is claimed by the police, they didn't find it. They haven't found it, like you would not expect to find it if the drug is like ketamine. But because it's not true does not mean that it won't be said. Now, when we engage in this sort of psychedelic exceptionalism, which is not warranted, it's dangerous and even deadly because what it does is that it really allows the sort of vilification of users of drugs not included in this category. That's one. And two, more importantly, what it does is that it allows the dehumanizing of people who use other drugs. And this dehumanization is the thing that really contributes to people getting killed.